Welcome to Built to Thrive, Lead-Free Strategies for Sustainability. My name is Merlene Tucker, and I'm running this web form along with my colleague, Juliana Azeredo. This web form is sponsored by the Leadership Academy for the Public's Health and produced by Dialogue for Health. These are both programs of PHI Center for Health, Leadership, and Impact. Now we're ready to meet our moderator of today's event, Karia Lustig. Karia is the director of PHI Center for Health Leadership and Impact. She develops strategy and overall operations of the center. Karia has 25 plus years in community health, nonprofit sector, and school-based programs and family centers. She's a thought leader applying strategic design and industry-leading approaches. Welcome, Karia.
Thank you so much, Marlene, and welcome everybody. We're very excited to have you with us today. Next slide. So I want to start by introducing you to the Center for Health Leadership and Impact. We're a public health do tank that helps individuals and teams transform their vision into data-driven strategies by cultivating leadership, catalyzing learning networks, and strengthening cross-sector partnerships. We do this to help create lasting impact in communities. And since 1991, we've worked with almost 8,000 leaders in 49 states and territories that have applied our tools and processes to address a wide range of issues, including lead-free communities that we're going to talk about today. Next slide. So our work is grounded in working with individuals, teams, and organizations across many different sectors to build healthier communities. The key types of organizations that we tend to work with the most are in the bullet points there and in the circle diagram that you can see on the screen. Today's conversation, Built to Thrive, Lead-Free Strategies for Sustainability, is about community health and is built through important things like infrastructure and investment, but also from the basic foundations of building connections and connecting to resources. Boots on the ground organizations doing these two things are needed more than ever right now. You are the folks building community, connecting people to needed resources, and supporting health. It's unfortunately common for investments to be made and then difficult to sustain due to changing priorities and fiscal disinvestment in key issues. The organizations featured today are making efforts while still in a multi-year grant cycle to put sustainability practices into effect. We're going to get to know a little bit about their approach. So the way we're going to do this is I'm going to explain, we're going to do some guiding questions. And I'm going to introduce our panelists here, explain what the question is, and then hand it off to them. So our first speaker is Tacoma Miller. She's the Director of Outreach at West Anniston Foundation. She's been there for 14 plus years, doing community development and public health outreach. And welcome, Tacoma. And next up, we have Cliff Porter, who's the housing manager with the Junction Coalition. He specializes in community engagement and education, case management, and resource connection. Welcome, Cliff. And our final speaker is Archie Beasley, who's the lead program manager, also at the Junction Coalition. He collaborates with and educates community stakeholders on the dangers of lead exposure. So welcome, Archie. All right. So our first question, we're going to have each of them do a little bit of a presentation in order to introduce you to their organization and the work that they're doing. So they're going to be covering how their organization thinks about and prioritizes sustainability. Included in that will be around community organizations they find most important to partner with, and which organizations and approaches to partnerships are they using related to funding or policy change. So they're going to cover that as a part of their introductory presentation. Then I'll move into some guided questions that I've prepared to help them cover some more around this topic. And then we'll open up for Q&A. Feel free to send your questions as we do the presentation, and we'll pull them up, as we go and have them ready for the conversation at the end. So first up is Tacoma. I
Hello,
hand it over to you.
hello. I'm Tacoma Miller, the Director of Outreach for the West Anniston Foundation, and it is such a pleasure to be here. Next slide, please. The West Anniston Foundation is a local nonprofit located in the West Anniston community of Anniston, Alabama. We have been around for 25 plus years, providing resources around health, education, and community development, with our ultimate goal to create a sustainable community. Our vision is to be recognized as the most trusted community revitalization organization in the region. Next slide. Anniston's population is primarily about 21,000. We faced population decline due to various situations, the closing of the Fort McClellan here in the community, as well as environmental challenges that we face. So, roughly, our demographics are 50 to 51% Black African American, around 42 to 44% white, and other racial ethnicities. The median household income is in Anniston is roughly about $44,000. Next slide, please. What the West Anniston community, which is the focus of the West Anniston Foundation, is specifically characterized as a community that has a very high population of Black residents, with families facing higher poverty rates and living in older housing stock. So, as you can see, this slide demonstrates the level of lead-based paint um, as comparison to our state and national averages in our target census tracts. And in the overall Anniston community, over 75% of the housing is pre-1978 stock. Next slide, please. And so when we think about our lead work, we think about it in the context of the historical context of the West Anniston community. The West Anniston community, at some point about 20 years ago, had a lead Superfund site. And so the industrial companies that were located in the area where they were allowing residents to use fill sand in their front yards, which around the time when the PCB cleanup was happening in the Anniston community, they found high levels of lead. And so in 2001, the EPA ordered a time critical removal of soil levels that were over 400 parts per billion. And so, as a result of that, we consider the cumulative impact of the potential lead risk exposures in our work. Next slide, please. And so, we've developed the concept of a coalition to use this coalition to empower the work that we're doing around lead poisoning prevention. We believe that it is so important to engage a variety of stakeholders in that work that we are doing. And we look at this from an ecosystems perspective, where we're reaching into the educational community, nutritional, behavior, housing, etc. And so our partners have included people such as the Alabama Department of Public Health's CLIP program, our local WIC office. We've partnered with local pre-K departments, as well as utilizing trained community health workers to reach out and engage with the community. And so we believe that this coalition is a vehicle for authentic community engagement, which is important when you are doing this type of work. The community engagement piece is so critical to sustaining the program over the long term because we bring together multiple stakeholders, their resources, their time, their effort, and that's how we believe that we can sustain the lead prevention work as we move forward. But our overall goal is to build a lead-free ecosystem in the West Anniston community. Next slide, please. And so we use an evidence-based approach, and we use the Healthy Homes evidence-based approach to reducing the lead levels in children between ages 1 and 5. Healthy Homes is an approach that has been uh, known to reduce lead levels, and so that is how we developed the whole Healthy Homes Coalition of West Anniston, utilizing that evidence-based approach of Healthy Homes. Next slide, please. And so we view this work from an ecosystem perspective. This is a picture of how the issue of lead touches so many different areas, from housing issues, from uh, learning difficulties, from school issues, academic failure, to criminal issues, special education. And so when we look at the work that we're doing, we take an ecosystem approach, which means that we touch multiple points within the community. And that's how we believe that we can sustain this work for the long term, is implementing it within these different ecosystems within our community. Next slide, please. And so this lead prevention ecosystem, our number one goal is to remove the lead from the community. But we know that takes resources, and that takes bringing together the local government and other entities to be able to finance these particular opportunities to remove the lead from the community. But not only that, we move forth and we provide lead screenings. We develop projects and we go into the community and we test people on site. We've worked with our public housing authorities to create events where we've worked directly hands-on within the community, testing people on site, and we've been very successful in doing that. So we've had two events with our public housing authorities in different communities, and we've tested over 60 kids on site at these community events. So that has been pretty successful for us. And not only that, integrating this work into early childhood development. So, working with our local pre K systems to host events and meeting the community directly at, in the center of the community and building relationships, supporting the educational system, those that are having learning challenges by using our partners who are skilled in behavioral health interventions, parenting advocacy. So, and then most importantly, empowering our communities and our families with this information to take it and make informed decisions with their lives. But most importantly, for the long term, we believe in building a workforce that can carry this work when funding is no longer gone. So we train our community health workers, both youth and adults, to be empowered with lead education for the long term. So we really believe in building an ecosystem that when funding is gone, we can still create and make an impact in the West Anniston community. So thank you.
Excellent. Thank you so much. So now we're going to hop over to Cliff and Archie at the Junction Coalition, and then we'll have our moderated discussion with all three of them. So handing it over to you, Cliff and Archie.
Thank you very much, folks. Again, my name is Clifton Porter. I'm the housing coordinator at the Junction Coalition, specializing in case management services and also helping folks to get their homes rehabbed, which ties directly into conversations about lead. A little bit about the Junction community. The Junction Coalition is a neighborhood nonprofit in the Junction community of Toledo, Ohio. And according to our master plan, which we put together with the help of the Toledo Design Collective in 2018, the Junction community is 87% African American. A report from the University of Toledo Urban Affairs Office on poverty data showed that 40% of the population has an annual income below 185% of the federal poverty guidelines. Additionally, that study showed us that the data coincided with higher incidences of poverty in communities of color at 50% compared to communities that are predominantly non-minority. And the reason that this information is important and relevant to our conversation today is that understanding the communities that we're serving has been really crucial to understanding how to best serve them. Next slide, please. The average education level in the 43607 zip code is lower than both the state and national average, with fewer than 10% of high school students graduating with a college-ready transcript. And most notably, over 85% of the homes in our area were built prior to 1978. And although it's not a 100% guarantee, it's pretty close that all of those homes are going to have some form of lead, whether it be in the paint, the water service lines, or elsewhere. So understanding all of these things is important to understanding not only where the risk areas are of where there may be lead, but also understanding the level of information and education that folks have on the topic already, which is pretty slim in our area and a gap that we seek to fill at events like you see in the photos below. Next slide, please.
All right, Junction Coalition and Lead Program Sustainability. I'm Archie Beasley, the lead coordinator here at the Junction Coalition. I've been privileged to be able to do this work while here within our community. Junction, we prioritize sustainability, and it's exhibited through our partnership with the City of Toledo in its creation of the Lead Resource Center. So the Resource Center is going to be the nexus of all lead information that all the partners are going to feed into. And by virtue of this grant, working with the city of Toledo, we were able to have that lead resource center created. They have an executive director now. She's been in place for about 7 months, and all the various partners and tentacles that have been doing lead prevention work throughout our area. Now we have a place to house our information where our community can go and get all the information that they need to help keep their families safe. The new City of Toledo lead ordinance was drafted based in part on the research and efforts by the Toledo Lead Poisoning Prevention Coalition, of which we are a founding member. This is huge. We fought and were in state court, federal court for almost 10 years to get this ordinance on the books here in the city of Toledo. And the great thing about it is it has enforcement teeth. So we're working to make sure that landlords of 1 to 4 suite homes have to make sure that their homes are abated, or the tenants have recourse. They finally have an opportunity to keep their children safe with enforcement. And we were able to do this by advocating by educating our public policy makers here in the city of Toledo to make sure that they knew that not only in our Junction neighborhood, but throughout the city of Toledo, which about 70% of the homes in the city are built before 1978, became a priority. All in all, we embody sustainability through the creation of systems and partnerships which bring together the knowledge and resources of numerous stakeholders. And I'm going to speak to some of those partnerships. One thing, coalition is in our name, Junction Coalition, and what we strive to do is to make sure and build out those sort of partnerships that will sustain us through. I'm going to talk to those here shortly. Next slide, please. We've connected our lead champions. When I speak of lead champions, I'm speaking of the folks that have been doing the work here in the community to keep our children safe from lead exposure. We've connected those champions to our churches in our neighborhoods and throughout our city, our community centers, our learning centers, and our federally qualified health centers like the Neighborhood Health Association and Medicaid managed care providers like AmeriHealth, Caritas, to allow the natural overlap in interests and values to foster meaningful connections, which are supported by our program, but don't require it in the event of funding source changes. What we've been able to do, I'll speak to our Neighborhood Health Association. For 2 years in a row, we've done a Get the Lead Out of the Holidays event there at their magnificent facility in downtown Toledo. At that event, it's a toy giveaway, but the main thing is to screen children, especially newborn to 6-year-olds, to make sure that they are tested for lead. And in the past 2 Christmas seasons, we have screened well over 130 children at these events, and it's been positive. We've actually been able to identify whole families that have had elevated lead levels and get them immediately to the medical attention that they need. So that's one of the partnerships that has really bared fruit. And what I'd like to call PPP, not the PPP loans, but pursuit, persistence, and persuasion. We pursue lead and housing stakeholders in our area persistently and persuade them to join us in the Lead Poisoning Prevention Coalition in our efforts. The Toledo Lead Poisoning Prevention Coalition is self-sustaining and guarantees long-term involvement. What we do, and you can go to the next slide and I can explain this in further. What we've been able to do is take a look at different partners and different segments of our city. Toledo is the kind of place where everybody kind of works in a silo, unfortunately, but everybody is looking to do good work. What we've been able to do is through persistence and persuasion is to reach out to an entity like our Toledo Lucas County Public Library. You ask, how in the world is the library going to be an integral part of our lead poisoning prevention? Well, many of our libraries have specific reading areas and reading rooms and librarians specifically that read to young readers, like in the 2 to 6 year old bracket. What we've done is made sure that lead poisoning prevention books are made available to those folks, to make sure to talk to those specific librarians to make sure that they know exactly what to look for a child that may be exposed, that has lead exposure. Um, Nationwide Children's Hospital, it's a natural fit to make sure that any of the health things that they're doing, that we're deeply involved in, to make sure that the children that they screen get the help that they need. The Women Palmer Y. One more that I really wanted to speak to is it's a community center in the heart of North Toledo, where we've hosted multiple events. Um, We've even done a sock hop, and we're planning a dance party with screening that's going to be provided from University of Toledo nursing students. All these um, entities that you see have partnered with us, and what they've done is they've been able to have their own take on keeping children safe from lead exposure in their own programming. It's something that they've taken off and been doing even without us. Some of the churches they have their health events, and they have gone ahead and moved forward to make sure that every event, even without any funding from what we have, they're going to continue. They see the impact and the work of keeping the children safe from that exposure. Thank you so much.
Thank you. Really excellent work. Thank you all. All right, so moving into the moderated discussion. So for these, we can drop the slides. And we will just have a discussion with Archie and Tacoma, talking about a few other aspects of your work so we can dive a little bit deeper. So one part of success and impact and sustainability that both of you described really well is really active community participation. And we know that we need that kind of in the long term to really sustain efforts. So how do you prevent advocate burnout and ensure that there's a pipeline of new leaders that are ready to carry on this lead-free work in each of your communities? And Tacoma, I don't know if you want to go first.
Sure, I'll go first. So for us, it's making sure that we're training the next generation of environmental health professionals. So training our youth as community health workers, training whoever wants to become a community health worker in this environmental health space to carry this important work forward. We know that lead prevention touches so many aspects of the kids' lives and the families' lives. So we empower the people in the community with the information to take it and educate somebody else by training them proficiently in this information as community health workers, as recognized public health professionals. We sustain for the next generation of lead prevention leaders.
For us here at Junction and in our coalition of partnerships, it's a mentor-mentee type of a situation to make sure that that burnout doesn't take place. I'll speak to one of our partners, the Fair Housing Center. George Thomas, their CEO, was instrumental in. He's actually the person that convinced our executive director, Alicia M. Smith, to write for the grant that we have, and he's been a lead champion throughout our area. What he has done is he's mentored another staff attorney in his office, a Mr. Noah Woods, who's young, sharp, and on edge to get out and make a difference. So in each one of our stops, what we've made sure to do is our champions are at a point of retirement and looking to do other things, that they've gone ahead and made sure to mentor the next person so that the space doesn't become vacant, that there's not a vacuum right there. We're making sure to identify first people that are passionate, that want to go ahead and step through, and make sure that they are armed with the knowledge to push through. And that's how we're going to help to sustain and keep our champions and our hard workers from burning out. Well, we have to make sure and cycle in new folks.
Yeah, really strong strategies. Thank you. And then I think at the foundation of what both of you talked about is really a super high level of trust that you've built in your communities over time, which I'm sure has taken, a lot of work to build that within each of your organizations. How do you maintain that level of community trust during all these transitions when, especially right now, when resources are more limited or harder to get? Do you have any specific strategies that you think about that are helping you maintain trust or that you are thinking of engaging in the future to help maintain?
I know. So for us, it involves just making sure that we're showing up. We're showing up in the community. If there's events that we can be at, community health workers are there. We're setting up tables. We're putting out information. We have newsletters, social media. And so those are ways to continue to educate the people, maybe when resources are limited. Just making sure that we continue to show up and spread the word about the importance of lead prevention. Showing up is the most important thing.
I would love to just echo exactly what Ms. Miller just said. Being, it's the popular thing to say, boots on the ground, uh, but literally making sure that we are present whenever there's an event, especially when it involves children, whether it's back to school, anything with our learning centers, anything with our faith-based organizations, that Junction has a presence. We're fortunate. We're in our 10th year in our neighborhood, and the work that we've done on multiple fronts has been received very well through the neighborhood. So when they get the communication from us, from our canvassing, when they get the email from the constant contact, when they see the Facebook or the Instagram post around lead exposure, by the brand that has been built of Junction, that they're more apt to pay attention to it. But we don't take that for granted. Each person within our organization gets trained on how to speak about lead exposure and how to make sure that we can get the resources to families if need be. And then they get it to and make sure and get the information to me as well so that we can move it up the ladder. So everyone within our organization, from the first person that answers the phone or the door or at any event, we make sure and always talk about protecting our children from lead exposure.
Nice, thank you. So we know that lead work and sustaining lead work really relies on policy change as well as community engagement. And I'm curious, and a lot of the programs that you've talked about relate to policy changes or policies that have been passed a while ago that connect to housing, water, soil, and other areas of lead work. So how much of your sustainability strategy relies on policy advocacy versus service delivery, and kind of how do you think about both those things working together?
So I think for us, I would say that we take a balanced approach. We know that here in our community that resources are limited. So we have, you know, attempted to educate our local government on the importance of pursuing funding such as HUD's led capacity building funding to build capacity to remove lead from the homes. So making sure that the teachers understand the return on investment. If you have a child that's lead exposed, how does this impact them for years to come? So understanding the return on investment and lead poisoning prevention is, I think, one of the keys. Just knowing that importance, but most importantly, continuing to show up and provide services. Like I said, our community health workers are trained lead inspectors. We can test at a point of care, so we can test for lead poisoning prevention on site. But taking a balanced approach, because we know that just focusing in on the policy perspective is most important, but it can get tiring because we come from a community that has dealt with a lot of trauma from the environmental health perspective. So really taking a balanced approach in how we pursue our local government, but also making sure that we're able to provide services to our community in spite of maybe some resistance from local government officials.
We've been fortunate here on the policy end of things here locally, getting our ordinance passed. That's it's been very very strong and an addition to our community, and through that, getting our lead resource center up. Our community is taking to finally having a centralized place where they can get information on making sure to keep their children safe from lead exposure through the resource center. Now at the state house level, right now, House Bill 307 through the Ohio it's stuck in committee in the Ohio House of Representatives. It's a bill that is set up to get rid of the 737,000 lead service lines throughout the state of Ohio. It's a 20-year project, $2.5 billion. So we're working with state stakeholders and lobbyists on that particular bill, and we're making sure to educate each one of our local representatives that are in the Ohio House of Representatives. Throughout here in the Toledo area, we have 4 representatives in the Ohio House, and it's bipartisan. There's 3 in one party, 1 in the other. When I have conversations with any of them, I say, lead poisoning doesn't care if you're a donkey or an elephant. It does not matter. We want to make sure and protect everyone across political spectrums, across precinct lines, across city and county lines, to make sure that the children are safe. So we're making sure to that they understand the importance of staying abreast on issues and bills like that, making sure that it stays to the forefront of their thought, and not something that's an afterthought. And that's how we've decided to make our approaches.
Great, thank you. And for our audience here, I'm going to ask one last question for our prepared questions here. And then if you have questions, I see a couple have come in. If you guys have further questions, feel free to write them into the Q&A, and I'll get to those in a moment. So one last of our panel questions here. If a peer is launching a brand new public health initiative tomorrow, what's one thing that you can do or that they could do now to set themselves up for a sustainable future?
I have to say that it would be building a coalition of like-minded organizations, individuals that believe in the mission for us, for a lead-free community. And so just making sure that you're aligning with people that understand the importance, and it takes a village and it takes an ecosystem to really make impact and to change the lives. And so aligning with people that understand the mission and the vision of what you're trying to accomplish is so important.
One thing that I can suggest is for them to do some research in persistence and persuasion. Really do first, before you start to go out to build out those partnerships. Find out what it means for your own personal, or your organization and you personally, what it looks like for you to be persistent after something, what it looks like for you to be persuasive about something. Understand your own personal strengths before you pick up that phone the first time, before you decide to craft that first email or that first letter, before you put together that first social media post. Understand your strength on how you can convince and persuade people that what you're going after is noble, it's true, it's something that matters, and it's something that the community needs. Once you have that fully internalized within yourself, every time you speak, every time you post, every letter that you draft is going to have that sort of DNA right in it. So that's my suggestion. Just examine how you persist through things and how you persuade, and make sure that that is intertwined in all the ways that you communicate, to build out your coalition, to build out your partnerships, to make sure that folks really want to continue to work with you and your organization. Being open to looking at organizations that may not necessarily look like they align. As far as what I do, I see lead everywhere, unfortunately. But I make sure that there's something that I can speak to any organization that they will be able to assist in our fight against lead exposure here in the Junction neighborhood here in Toledo, Ohio. So that would be my suggestion.
Great suggestions from both of you. Thank you. All right, so to get to some of our questions here. So for both of you, or any of you. Can you talk about what type of tests you need to test children? That's a kind of specific question. But they said they were asking about capillary versus venous lead care or lab. Do you have recommendations on one specifically for children?
So for us, we have partnered with this organization called Cassie Medical Services, and so we have a Magellan point of care test where we can actually do the not the capillary test on site. So that's what we use at our program events to test kids on site.
For us, our partners, Neighborhood Health Association and the University of Toledo nurses have been using Magellan as well for the capillary prick test, and that has been the one that has served us well. I believe that's actually the one that the Lucas County Health Department utilizes as well.
Perfect. Thank you. All right. And then can both of you speak about, you talked about different types of sort of community training programs. Tacoma, you talked specifically about like CHW certification. Archie, you talked about other kinds of community training. Can you speak about how you train CHW specifically and or community workers of any kind in the environmental health space? The person that asked the question is starting work on that in Pennsylvania. Their current certification program in the state doesn't have an environmental health information section included. And so they were curious about how to go about doing that. And then to expand it to you, Archie, I know that you guys use possibly not a CHW certification, but sort of how do you prepare or train them? For
So our
Tacoma?
Yes, so our CHWs are actually trained through a curriculum provided through Morehouse School of Medicine that aligns with the National uh, Association of Community Health Workers, their policies and procedures for community health workers. So it touches on all 19 of those particular areas, as well as we train our community health workers utilizing the EPA-led awareness curriculum that is provided through the EPA, which is a really um, uh, c- easy to understand curriculum that can be used in high schools to train youth, et cetera. So that's what we use to train our community health workers in the community.
Here at Junction Coalition, we don't have community health workers. What we've been able to create is an ambassadors of people from the neighborhood, people that people recognize. What we do is we've brought them in through our community organizer, where they get specific and updated training on how to speak to families about lead exposure, how to clean, how to make sure that they're doing things correctly. We go by all the things that we've learned from CDC and share those strategies on how to make sure that we're communicating to our population. One thing that we found is since we don't have uh, professionals that are out doing that sort of speaking engagement, by having people in the community, people that they'll see at the store, people that they worship with, people that they shop with, uh, hearing it come from them is even more effective than coming from someone like me who talks about it each and every day. Just hearing about it from your buddy or your girlfriend has been very a very effective strategy for us.
Great, thank you. All right, next question. This person says that they have experienced physicians that are resistant to lead testing in their community. The doctors believe that it's no longer an issue and can be a barrier, and this obviously can be a barrier to testing. Have you encountered this in either of your communities, and how did you use persuasion?
We have encountered some parents who have had issues with saying, well, our pediatrician didn't tell us about the need to screen. So for us, we have created and we educate our parents on the importance of making sure that they're talking to their pediatricians about the risk assessment that needs to be done at 9 months old and making sure that they're asking, hey, my child is 12 months old. I need a lead screening. So empowering the community members and parents with that information to take back to the doctors and request those tests have been effective.
Through every one of our educational events, anytime that we're out having an opportunity to touch expectant mothers, young mothers and fathers of children, we let them know that when you're taking your child to the wellness visit, you ask the pediatrician directly, I want my child to have a lead screen. Because we haven't run across a huge issue with it, but there are pockets of pediatric clinics that have been resistant, or it's further down the list of things that they want to get accomplished. And we're making sure to elevate the awareness in the parents first, because the parent has to be the first advocate for their child. So arming the parent with the education to know that, hey, absolutely, I can ask my pediatrician. I can demand my pediatrician to do these screens for my child. Is something that we want to make sure and empower our parents, especially some of the younger parents who may take a look at a physician and feel a touch intimidated, especially from the socioeconomic environment that we work with here in Junction. We want to make sure that they understand that you are the biggest, strongest advocate for your child, and nothing that just because someone has a couple of extra degrees, they may not know the best for your child. You know the best, and you let them know to go ahead and get that screen. So educating is how we go about it.
Great, thank you. And then this is another sort of specific test question, but a couple questions came in related to youth and if they're tested and have an elevated capillary test, sort of how you manage that, because there could be, I guess, false positive results. And then are you following up, or how do you get support to families to figure out how to get another test?
So yeah, for us, once we do the points of care testing at our events, that information is given to the parents, and we ask them to follow up with their pediatrician for a venous screening. We then follow up with those parents to ensure that they have made sure they've reached out to the pediatrician to set up that appointment for a venous screening. So utilizing our community health workers as those who come behind us to make sure that the parents have the resources in place to address that issue, and following up with them at 3 months, 3, 6, and 9, after they have received that positive capillary test.
What we've been able to do, because it's through partnership and collaboration with our medical partners who do the screenings. Um, we work with them to make sure that they're doing the follow up with the families after maybe a high capillary test, to ensure that they get the care necessary. At some of the major screening events, when we're at NHA, we're able to seamlessly slip right from capillary right to a venous test, because we have the medical professionals, we have the lab, we have everything right there, because the event is set up to do so. At some of our smaller screening events that we may do at the community centers, or on a site of one of our public housing facilities, we make sure to that the professionals follow back up, and we work with them to the detail that we can, as far as gaining health information and such, to make sure that we touch and get the families taken care of.
Excellent. Great suggestions. Next question, or I guess it's not really a question, but I'm going to turn it into a question. But this person is saying that their CHWs perform a comprehensive assessment around healthy homes and environmental condition in housing. So I'm curious, do you have, what type of assessment do you use? Is there a specific one from a specific organization that you might use, and have your community workers be able to perform some sort of comprehensive assessment? I know both of you do, work around healthy housing in different ways.
Yes, so for us, we actually, at the time of the screening for the lead, we actually have our community health workers. The parents have to fill out a health-related social screenings need assessment, and then that information is given back to us. But on top of that, our community health workers are trained as through Healthy Homes principles. So to be able to identify those risks within the home that could also be impacting their health, and that particular certification actually comes through the Build and Performance Institute, and it's a Healthy Homes Principle certification.
So how we tend to address housing as a public health issue, and I can speak to it just because I'm the housing coordinator for our organization, is by having an overarching home-based program, base meaning basic access to sustainable enterprise. And within that program is housed our housing program as well as our lead program. And so Mr. Archie and I work hand in hand to make sure that we're communicating on my end when I'm talking to folks about wanting to get home repairs, why lead is a concern, and on his end when he's talking to folks about lead education, how lead awareness can materially impact and better their housing and living situations. And part of that is, for me, with the housing program, starting to partner with and advocate with the medical professionals and medical companies and organizations in our area to see housing as a public health issue, because we entirely agree. If somebody isn't housed, I guarantee that one of the local hospitals or medical professionals is going to be seeing that person eventually. And likewise, we need to be making sure that not only the medical professionals, but the individuals in our communities see it as a public health issue, so that when we're looking at homes that are blighted and potentially causing a health hazard for a community, we have our residents and community members that understand why it's important we address that issue quickly and safely.
Perfect. Thank you. And then final question I'm going to ask each of you before we move into closeout is, can you each provide a story of hope about what you're doing in your communities?
I would have to say for us, one of the stories of hope that I had was at one point we were managing a Healthy Homes production grant through the Office of Lead Hazard Controls and Healthy Homes. And one of our particular clients on that program came to us because her granddaughter at the time was 2 years old and had been identified with a high blood lead level. And so when the Department of Public Health sent the environmental people out to do the assessment, they were unable to test that grandmother's home. And so, as a result of her being a part of our Healthy Homes production grant, we were able to test that home and identify that the grandmother's home was a source of lead. So, sometimes the focus should not always just be on the home environment, but also take into consideration places that the children visit often. And so, we were able to identify that and to address that issue.
That's a
Yep.
great story. Thank you.
Recently, and as Mr. Archie talked about, we have our cultural competency presentations that we've been giving in the area to community health workers as well as general community members. Myself and a couple of other colleagues of ours went to the local all-girls elementary school, LP Stewart School here in Toledo, and gave a cultural competency on lead communication presentation to the faculty and staff there. And it went so well that at the conclusion of the presentation, one of the faculty members said to us, like, this information is so helpful for us understanding how to communicate to the population that we're serving. How about we do this kind of presentation, not only with the family members, but with the students that are at the school as well. So not only are we making faculty and staff members more educated on the topic of lead, but they are becoming so passionate about it that they are now planning and organizing themselves an event for us to come give the presentation and also provide free testing for young people in the neighborhood. And I think that that speaks to hope because, as Mr. Archie was talking about earlier, champions making champions, the earlier we can get them passionate about lead prevention, the better long-term for our community and our city.
Great, thank you. So let's use those react buttons on your screen there to give a big thank you to our speakers. Really great job and wonderful examples from your communities. Thank you so much. So thank you all for joining us again. Our website here from the Center for Health Leadership and Impact and our lead work is linked on the screen. You can also reach us there at that telephone number and email. We have a survey that's going to come up as you close out of the webinar. We really appreciate your feedback. They help lead into other webinars that we might do with our Lead Free Communities group, as well as other Dialogue for Health presentations. So thank you so much for joining us, and we hope that you, if you're new to our work here, that you join us for a future webinar. And thank you again to our fabulous panelists.